Alrighty, g'day year ones. My name's Patrick. I'm a fourth year student and I'm currently on RCS, which is the Rural Clinical School Placement. So you won't see me around Curtin as I'm down in Bunbury. But welcome to the year. Hopefully this video gives you a little bit of a guide of what's going to be happening. Something I wish I had when I was in year one. And hopefully it gives you something so you can sort of see what's going on before you get fully stuck into it.
Patrick from the future here. Please watch this sped up if you want.
All right, let's get into it. We'll start with sort of how the year's going to work, and then we'll go into some of my tips and tricks. When it comes to study-wise, I've actually got 2 other videos that I've already made, and my blog, so you can just have a look on there, and then that'll go into it because there's no point in me repeating myself over and over again here. Okay, so, well, you're here, that's good. Let's get into it. See if my camera can see the whiteboard. All right, I'll move this out of the way. All right, let's give you an overview of the year. So how it's gonna work is, maybe this can't see me fully. Hope it can. So, your year, I'm pretty sure, because the course has changed now, it's not the same as it used to be. And so I've just had a chat with your year coordinators, and then I'm making the video from that, but I obviously haven't done the new course structure, and my previous video on year one is no longer fully relevant because you do courses that are no longer there. But how the structure of the year is working, I'm fairly sure that you guys are doing the same full year degree that we're doing from year 2 onwards, and obviously from first year onwards is you start, you might be doing the normal time period. Doesn't matter. You're going to be doing a degree that's almost a whole year degree now, and you're going to be only having 1 unit, and that unit is GMed 1000, I think. It'll be called something like that. So your first 5 weeks, you've got O week, which, I don't know, you don't really do too much in, pre-reading. And then you got 5 weeks, and in this 5 weeks, it's going to be foundations. And so these foundations are, I hope this can be seen in the other camera, just check. Let me just move it a little bit. Cool. All right. So these 5 weeks, first 5 weeks, this is foundations. So this is going to be basically human biology and physiology. Now, if you haven't done human bio in high school, don't worry too much because you'll pick it up. If you have, means that this will be a lot easier for you. So yeah, just take the win. So the foundations, that'll be, anatomy of the various body systems. So we work in body systems, and what a body system is like something like the respiratory system, the integumentary, so the skin, the central nervous system, the peripheral nervous system. And so what you'll be doing is you'll be given basically probably a system for a week or half a week, and you'll go over the anatomy of that system as well as the physiology of the system, which is how it works normally. And then that means that gives you a base for later when you start to do the pathophys. So pathophysiology is diseased physiology. So this is normal. And this is not normal. But before we get to not normal, we have to understand how normal works. And so you can't understand, issues with anatomy or issues with physiology if you don't have a really good basic understanding of how everything's working. And that's pretty much what this whole year is for you guys, is getting a really good grasp on your foundations and how everything works. Because if you understand the perfect physiological pathways, you can understand exactly what's going on. So I would not encourage you to jump too quickly to pathophysiology until you have a really good understanding of the physiology. And how you can do that is you'll obviously be given lectures on it. You'll have seminars, you'll be given textbooks to look at. There's videos like Osmosis, Boards and Beyond. I've got other videos covering that. So you can watch them, you can do your study. But if you're still not getting it, I'd highly recommend you go to something like ChatGPT and just tell it your current understanding and then get it to help you make a full understanding of how the system works. And it's really good because you can ask it questions like, let's take pneumonia for example. You go, how does the bacteria get into the lungs in the first place? And you just ask that to ChatGPT and it'll give you an example, and then you can go, wait, but doesn't the lungs reject them? And then, ChatGPT will go, yeah, it does, but in some cases the bacteria overloads you or your immune system isn't working properly. And then you can see how you can really understand it. Now, that probably wasn't the best example because that was pathophysiology with pneumonia. But for like gas exchange in the lungs, taking air in, putting it into your bloodstream, that's a really good one to use ChatGPT for because it is quite complex and you really need to have it down and understood. And if you understand it now, you're going to be using this for the rest of your career. So this is really important to be making a good foundation phase. And that's what I think you guys should view this year as, is a foundation for the next 4 years of your degree after that. And if you stuff around now, you're going to be building your house on a really weak foundation. So I'm going to be saying that this year, really focus on your anatomy, physiology, understand that well, and you'll be set for the years to come. Now, after this first 5 weeks, you're just going to have the basic stuff, and you'll be moving into So after this first 5 weeks, then you'll be moving into PBL, and that goes for the whole rest of the year. So I'm going to I'll put up a calendar, so I'll give you an example week, and this is just the basic sort of example week structure you can expect from week to week. It doesn't really change for the next for years 1, 2, or 3 for you guys until the end of year 3, and then 4th and 5th year are their clinical years, so you're not at uni. So let's go here. See if we can see them all in the camera. Okay. Now let's say that this is a 2-week block, and how this is probably going to work is, now the days of the week will change, but things don't change that much and they'll just be moved around a little bit, so you can have a basic understanding. So let's say on a Monday you might have a clinical skills, and that would happen on both Mondays, obviously, because it happens every week. What clinical skills is that's learning the basics of interacting with patients, because we can know all the textbook work we want, but if we can't talk to a patient, if we can't examine a patient and just have a conversation with them, then we can't apply anything. Because, I'll keep going here. So we need to know how to talk to them and how to figure out what their issues are, because it's all well and good reading the textbook, but if we can't figure out what their issues are, then we can't do anything about it. So that's what the clinical skills sessions are. They're with a tutor, they're about an hour and a half, and they're in the same rooms as that you had your MMIs in. Please do your pre-reading for this. It really makes the sessions go faster if everyone knows what's going on. If the tutor has to stop and explain it to people who just aren't getting it because they haven't done their pre-reading and their pre-research, then It's a waste of a session for everyone. So I really think you should be doing your pre-reading, and that includes just watching YouTube videos on it. There's like lots of doctors on YouTube that have videos about those clinical skills, and so you can read and watch the ones that they give you in the pre-reading, and then just go and do your own. Like, sit there, watch dinner, find a guy that does a good video that you like, just sit back and watch. That's the level of pre-reading you have to do. It's not much. It's maybe 10, 15 minutes, but it means that this whole class, you get so much more out of it. And these tutors can give you a lot more information because they can take it to a higher level. And it's all about taking it to that higher level by doing your pre-reading. So I'll get more into the pre-reading in a bit. Now, on a Wednesday, you'll have your next big thing, and that will be PBL. And I'm going to color code them to make it easier. Got a different color here. Yes. Okay. Now I want you to imagine that we've had a week before this week, so that it'll make sense when I explain it. But you can kind of ignore that top one for a second. So in the first PBL, what's going to happen is we're going to come in and we're going to have a look at a case. Now the case will be read trigger by trigger, and I'll show you that in a sec. And that is going to look like, Johnny comes in with a sore foot, his mum's worried about it, and the foot looks swollen and red. And then you will discuss between yourselves, what do you think Johnny could have? What are some investigations you want to order? What are some more questions you want to ask Johnny's mum? And you want to ask Johnny, what are some things that you don't know about yet that you need to go home and research? And so you go through a whole case, and I've done that in another video, and through that whole case, you'll come up with these things called learning objectives. So these learning objectives are things that you don't know about yet. Let's say Johnny had ingrown toenail, and then he got cellulitis, so skin infection from that. So you don't know anything about skin infections. You don't know anything about the skin immunity. You don't know anything about how the blood works to fight off infections. You don't know anything about treatment of those infections. What else might you not know? Management of those infections. And there's quite a few things that you'll come across in the case, managing parents, managing expectations. So let's say that by the end of it, you get around 10. Each person will get given 1 point to go home and research. So let's say you're given normal skin immunity. So that would be how the skin works to fight off infections just naturally. So you go home, and over the course of that week, over your Wednesday evening, Thursday, Friday, Saturday, Sunday, Monday, Tuesday, you do some research and you bring in a sheet of paper. This might change slightly, but the principle stays the same. You bring in 1 page or a half a page that you sent to your colleagues the night before, so they can read it as well. And then you come in the next day, on that next week, and you discuss the case, but with your new information that you guys have all gone away and learned. So now you can read it with that new clinical light, an understanding of how the skin's working to fight off Johnny's infection. You can understand how you're managing that infection, understanding how you're talking to the parents. And so that's the joy of PBL, and that's how it should be done. Now, how it turns out, if you guys don't look out for your colleagues, is that everyone sits through this one, doesn't really contribute much because they think that they don't know, and of course you don't know, but people don't want to seem silly. But you can say the craziest stuff in there. I mean, Johnny comes in with a sore red toe. I could turn around and say, oh, Johnny's got, toenail cancer. Or it might seem a little bit silly, but it's not that silly. And your tutor is there to guide you along. And so don't be afraid to speak up in these classes, and that's what it's all about. You're actually being graded on your participation. So you need to be participating in order to be a good doctor in the future, because that's what they expect on the wards, is that you might be able to give a point to the senior doctor that he hasn't thought of yet, just because you've recently read about it, and you could actually really make a difference in that patient's life just because you stood up and said that point that you thought, oh, maybe it's a bit silly, but it's probably not. Okay, and that's the same thing. It starts now in PBL. So if nobody talks in your PBL, then it's not very good. So please talk, say things. Doesn't matter if it's a bit silly, just talk, okay? And then the next thing that happens is that people come along and they go, oh, I've got to make something up for the rest of you guys. Okay, let me just copy and paste, paraphrase what the textbook says about it. If I wanted to read the textbook, I would go read the textbook. Your colleagues, if they want to read the textbook, they'll go read the textbook. There's no point in just paraphrasing the textbook. Okay? The textbook probably does a better job of it than you can. And there's no point. You need to just give small, clinically relevant stuff to you guys at your level of things that you've learned, interesting things, half a page to a page max. Okay? And also don't give like a just regurgitated bit of ChatGPT. Go research it. Go look at interesting sources. Go look at YouTube. You can read the textbooks, go through it all, and then come up with your own approach to it. Okay? It's really not about just regurgitating a textbook or ChatGPT. They're just as bad as each other when you do that. Okay? If everyone comes in with stuff that's basically the textbook, that means that this session is boring. Okay? And it means that your pre-reading the night before is boring. And then what also happens is that you come in and nobody's done their pre-reading the night before. You'll hear me say it a lot about pre-reading. Really important that you do it, okay? So if someone comes in, they haven't done their pre-reading, it's just a pain. Because everyone can tell that you haven't done any pre-reading. And if it happens once or twice, yeah, that's fine. Things happen, you know. You have events on the night before. That's okay. But it doesn't just happen one-off. People do it again and again and again and again. Your tutor notices, they write it down about you. It may not affect your course progression, but it will affect how your peers perceive you. So please do your pre-reading the night before so you actually have something to discuss. Now, if you want to go above and beyond, and this is what I would highly recommend, is that, yeah, you've been given one thing to research, but how can you understand how relevant that one thing is to research if you don't understand the whole picture, the whole case? So I would say, go ahead and read up on the whole case. You don't have to go into really a lot of detail, right? But you can ask your favorite AI, you can watch your favorite YouTube, read your textbook on those things to have a more broader understanding. So that when you write your first list of things to present to your classmates, you understand what's going on a lot more. And you actually can understand in that second coming through of the case, and you understand the whole clinical picture. Because it takes a while to synthesize that information in your head from just reading it the previous evening. But if you've been reading it since the week before, when you just got the case, and you've been reading up on it, researching it, then you'll be on another level. And that's where it comes in for your second and third year, right? Just because you have one learning objective to do now, doesn't mean that it stays that way forever. And it's a really good habit to get into now. So if you can do those things, participate in the first session, say silly differentials, say anything, okay? Then do your pre-reading before the next class, do your research, and do your own research and not just regurgitate ChatGPT or a textbook. And then if you can come in the next day with having read what everyone's doing and a bit of an understanding of the case, this discussion is going to be so much better. Okay, PBL can be really, really boring if nobody participates. And hopefully by telling you this now, you will start to participate. Now I know a lot of you are probably really quiet, but you're gonna have to start to speak up, okay? Being quiet isn't gonna get you, this is not a degree where you just, or a profession where you just sit back and say nothing. You have to be upstanding, talking to patients, you have to be talking to doctors, you have to be talking to family members. So get onto it now, and then it'll be a lot easier later. And then in that afternoon, so you'll come back and discuss the case in the morning. In the afternoon session, you'll move on to a new case, and the cycle repeats itself. So you get a new case, you discuss, you get your learning outcomes, you come back a week later in the morning session, and you go over it again, okay? With the new things again, and then, you know, in the afternoon, you get a new case. So every week, you're learning new things. I think there might be 32 or something like that. A large number. There's about one for every week that you guys have of these cases. You might get a week or two off before your exams, and so that's how it works. And then these are your two sort of key sessions for the week: your PBLs and your clinical skills, with tutor led. And then in between that, you'll have lectures. Okay. I don't know when your lectures are. Don't know what's going on with them. You have to go to the lectures because of the attendance requirements. So go to your lectures. Points on lectures. There's pre-reading that's uploaded. Please go do it. Just have a look through. It doesn't take long, 10, 15 minutes at most. Okay? If they put a PowerPoint up, I even just put it into ChatGPT and I get it to take me through it one point at a time with some quiz questions. It takes me 15 minutes. Okay? And then if there's no pre-reading, there's a lecture title. Okay? B-cell disorders. How hard is it to just go to YouTube and look up B-cell disorders and watch a 10-minute video on it? Okay. These clinicians, they're highly respected in their fields that are coming in to teach you, and they're giving up their time. Most of them are doing it for free. And so please show them the respect that they deserve by doing some pre-reading so that you can come in and you can ask them good questions about their lecture. Okay. If you're sitting there and you don't know anything about what's going on, you may as well have just watched the lecture at home. Okay, you have to be there, so you need to come in with some understanding of what's going on. That way you can take better notes when you're there, that way you can ask better questions, and that way the clinician actually appreciates it and thinks that they're getting something out, that you're getting something out of it. So every lecture you go to, just pre-read before it. Okay, it's a great habit to get into now, and just keep at it forever. So let's say you have lecture here, lecture, lecture. You'll probably be at uni 3 or 4 days a week, maybe I don't think 5. They usually give you 1 day a week off. So let's say you have that, maybe another lecture here in the morning. Lecture and seminar, basically the same thing. Okay, you might have some workshops interspersed with them. It's all very similar. The other thing you'll have is labs. So you might have 1 to 2 labs a week, and these will be anatomy labs mostly, or physiology labs. And so these will be things like blowing up pig lungs and seeing how respiratory system works, playing around with the spirometry machines, which tell you how much volume you have in your lungs. So they're really good things to go to. And once again, there is an attendance requirement, so you have to be there, right? You may as well get the most of it. You can't sit in my years, our attendance requirement was changed. So before there wasn't really one. And then people just didn't go to the labs and things like that. And then that changed to that 85 or 90% attendance requirement to progress. And so a lot of us had that opinion, that mindset of, I'm not going to get anything out of these labs. And so they were just a bit jaded. Now you guys going in, you have this already, attendance requirement already set. So there is no other option than just to go. So you may as well get time out of it. You're going to be there anyway, right? So you may as well get something out of it. Labs, once again, there's pre-reading, do pre-reading. You get a lot out of the labs. And if you go to every lab, by the end of the semester, okay, it might not seem much, but an hour and a half a week over 25, 30 weeks adds up a lot. And so when you're in your exam and then there's a question about perhaps rib anatomy, and you've done the lab on the ribs and you've answered the questions in the lab about ribs, you can just visualize it and it's there. Okay, it's really important that you go to them, not only for your learning, but for your future patients, right? This is not just about us and passing the degree, right? It's about patients in the end of it. And so when I don't really want to do stuff like this, I think, is my patient, future patient, going to be pleased? They're never going to know, but are they going to be pleased that I didn't go to this lab and then now I possibly missed something because I didn't learn it at school? Not really, right? So go to your labs, they're really good, especially with a guy called Morgan Titmus. He does anatomy labs and they're amazing. His lectures are among the best. So please go to them, do your pre-reading. I think that's probably about the structure of your week. You might have some more seminars, you might have some less seminars, you might have some workshops, but that's the basic structure of PBLs, clinical skills, lectures, and labs. Okay, you might have more than one lab. I don't know how it works. So that's how it's going to work, and you'll be randomly allocated these with a group of your classmates, so you can't go with your friends. Let's go into some other stuff. Oh my days. Nothing's working. All right. Let's move into probably the most important topic I'm going to be talking about today, and this will carry you on for the rest of your career. That is professionalism. Okay, so as a med student, you are held to a higher standard than just about everyone else at uni. Okay, so I don't really care if you come from engineering, don't care if you come from some other degree, I don't care if you come from high school, right? We're held to a higher standard than everyone else at uni because we get more privileged access into people's lives. And that's a big thing that we need to, recognize and keep going forward. I'm sure you'll get some other lectures on this because it is that important. And people that shrug it off, well, they get found out and they get rolled back in the course, they get years repeated, and then that's a permanent black mark against them for the rest of their careers. And people talk to each other. You'll come to realize that medicine's quite a small place and there's lots of doctors that, they see you in a lecture and then they go back and they might not say anything to someone there, but then they see you in 2 years' time and they go, oh, that was that kid, or that was that student that was talking in my lecture, right? So professionalism is a big deal, and it's something that you should be aware of now, early, set the habits up so that it's just your way of life from now on, and it's not something that you have to force yourself to do, okay? So, probably the number one thing is that you're professional at all times. Okay? This means whether you're at the club, this means whether you're at the pub, okay? Professional at all times. So with everything being filmed nowadays on Snapchat, can you imagine, once you imagine, anything you say, do, can end up on the front page of the West Australian, and it's happened, right? Anything you say or do, anywhere, anytime, can end up on the front page of the West Australian, okay? So you need to be on top of this at all times. Look at the med school code of conduct, look at your AMA code of conduct, okay? And then follow those pillars that they've set out. It's something that should be obvious, but it's not, okay? Especially when alcohol, things like that are involved. And so if you start to bring the med school into disrepute, the profession into disrepute, they'll get rid of you because it's not worth it, okay? And your patient doesn't want the guy or the girl that did something horrific on a night out, or it doesn't even have to be that bad, because they want you to be held to a higher standard. I'm sorry, that's just how it is. and that's how it should be. So, professionalism at all times. Professionalism, dress code. Okay? Like I said before, it doesn't matter what the other students in other degrees wear to uni. We're at the med school, we're different. Okay? We're held to that higher standard. So, like, if you're a lady, don't wear anything inappropriate. If you're a dude, don't wear anything inappropriate, right? If you could wear it to an office, that's the way I like to think about it. Okay? So if you could be seen in the hospital or in the office in it, then that's good enough to wear to the med school. If you can't, you shouldn't be seen in the office in, Birkenstocks, your shorts and a singlet. You can get away with it, but once again, people see you, people are watching, okay? If you don't hold yourself to that standard every day, it just reflects badly on you. Now you can get away with, like I said, Birkenstocks, shorts and a t-shirt, but it's just not a great look, okay? Now, what I'm wearing now, I'm going to placement later, so this is slightly updressed, but I mean, if you're a guy, you can be wearing one of those nice Uniqlo collared t-shirts, and some pants or some nice shorts and shoes, okay? Or a polo or something like that. You are in a professional environment. It's not like school. You just buy yourself some clothes that you can just wear as a uniform, change them out, okay? And just don't wear anything inappropriate, because these clinicians, they're used to seeing people in professional attire all the time. And so while it may fit in at uni, for them, it's going to stick out like a red thumb, okay? So dress code. And my next one is promptness. Okay. Better late than never, but never late is better, okay? Early at all times, minimum 5 minutes. Okay. Yes, there'll be times where you're late because of traffic or something or other, okay? But you need to build up that reputation of you're always there, on time and early. 5 minutes early is your new start time from now on. Put it in your calendar. If it starts at 8, I have all my stuff set at 7:45 so that I go there at 7:45 and then I have that buffer built in. If it starts at 8, put it in your calendar at 7:55 that you have to be there, okay? Clinicians don't like their time being wasted, especially when they're on, 2, 3, 4, $500 an hour, and they're there doing that to teach you for free, okay? Don't waste their time, and it really interrupts lecturers, okay? You'll see some of them, like Dr. Mark, and he is very big on it. He'll give you a professionalism review if you show up late to his lectures. And there's a lot of lecturers that won't say anything, but they'll notice. And a lot of clinicians, like I'm saying, they notice, but they don't say anything to you then, but they'll keep it in their head for later, okay? Build up a reputation of being prompt and on time. Next one, pre-reading. Should be standard, you should be doing it, okay? It's, the med school doesn't stress it enough, but I've gotten so many opportunities from doing my pre-reading, in the sense that I'm in the lecture, I can ask good questions, I can talk to the clinicians after, because I have a bit of an understanding of what's going on. And they go, wow, this guy's really switched on. This guy or girl has actually gone away, and I can tell that you've done some research about them or about their topic, okay? And then they go, oh, I've got this coming up this weekend, do you want to come into clinic for a day with me because of this? It's the key, okay? You will see, once you start doing it, you'll notice that your colleagues that aren't, okay? Because they're sitting around in the lecture going, oh, what, you got like, what? And you're sitting there going, oh yeah, cool. And then you ask a question that furthers that time, okay? You have to be in lectures, you're required to be there, so you may as well get the most out of them. And the way to get the most out of them is to do your pre-reading so you understand the topic beforehand, and then you can ask really good questions on top of it, okay? Pre-read. Doesn't matter what it's for, okay? And then you carry that onto your clinical years, I'm going to a breast clinic later this week. I do my pre-reading for the breast clinic. I just look up common conditions. Done. That way when the clinician asks me a question, I have it there, okay? It's not that hard to do a little bit of pre-reading. If you set it as a habit, you can just keep it going. Okay, even 30 minutes before the lecture starts, you just watch a quick YouTube video on it. Okay, there's YouTube videos on everything. There's textbook articles on everything. Just have a quick look, have a quick read. Okay, pre-read. If you get anything out of today, it's that you should pre-read for your lectures, pre-read for all your classes if you can, and then be early, on time, and appropriately dressed. So I think that's my, top professional things. And this also, goes for what you say, what you do, how you carry yourself. You shouldn't be, making inappropriate jokes around the uni. You shouldn't be making inappropriate jokes online. Everything you say online is tracked. There's cases of, this will probably worry some of you, there's cases of you can be reported by a patient for the Instagram Reels you've liked. So I want you to think about that and go, wow, if I can be reported to the board of practitioners because of, something I've liked on the net, keep that in mind. And then that's a pretty small thing versus something that you say to someone and they can report you to the med school, and then you have to do a professionalism review, and that's a mark on your record forever. So professional at all times. Okay, what else? Let's talk about exams that you have. I want you to think that of everything that you get taught as accessible content, okay? Anything that anyone says to you is accessible content. And if it's not accessible content, it's probably relevant to a patient in the future. So this is no longer like high school, and I said this in my other year 1 guide video, where you just learn it for 10 weeks for the exam and then forget it again, okay? I personally don't remember any, maths from high school. I don't remember any physics, but I can remember stuff from first year, second year, third year, and I can apply it today to patients I see, in clinic or at the hospital. So everything you're taught, everything someone said, not everything your peers say is accessible, but everything that teachers say, clinicians, lecturers say is accessible. So exams, what you're gonna have is you're gonna have clinical and non-clinical, and then this is sort of the column for must pass. Okay, your non-clinical exams, this is your CATs. Now they don't meow, but this is your cumulative achievement test. And so what a cumulative achievement test is, like in the name, it's an assessment of everything you've learned up until that point in your med school career. So when you go into CAT 1, it's everything that you've learned in those first 8-10 weeks. When you go into CAT 2, it's everything that you've learned from those first 8 to 10 weeks, and then the weeks after that CAT as well. So I can still be tested on things in my third year CAT that I learned in first year. And so that's really important to understand, and don't let people dissuade you into saying, oh, I came up in CAT 1, it won't come up again, okay? Yes, they obviously for the first CAT, 100% of the content is going to be from those first 10 weeks. But then when you go into your second CAT, there's still going to be like 25 to 50% of that content from those first 8 to 10 weeks. And then there's going to be the content from that next period. And the same goes for your end of year, okay? And when you see a patient, they don't care that you've just learnt it or not learnt it. It's all accessible content for their, it's all something that you can apply and you need to be keeping up on. So this is why tools like Anki are good. This is why it's important that you keep reviewing and staying on top of your content. I personally really like to walk around every day knowing that if you gave me a CAT right now, I'd pass. It's a really wonderful place to be in, and if you start early and you stay on top of it, you'll be able to stay there for the rest of your, med school career. So I would highly recommend that, because when I was in first year, I was not in that place at all, and I had some family stuff going on. Didn't really know how to study, didn't know how to do it properly, and by the end of the year, I had so much stuff backed up that I had to spend a week literally staying up the entire week before my exams. Sleeping in 20-minute blocks. Now I don't have to do that. I taper before the exam, in the sense that I've already learned all the content. I don't need to study any extra. Okay, it's already in my head. It's already in my deep memory, and I can just enjoy my life in the 2 weeks in the lead up to exams. Okay, that's a much better place to be in than it is to be in, staying up doing all-nighters. Okay, much better for your health, much better for your patience in the future, and that's what it's all about. So there's your non-clinical, there your CATs, and then your clinical, that's your OSCE. Now, I'm not sure what the O stands for. Maybe it's observed, I don't know. It's a simulated clinical exam. So it's in the MMI rooms, and they're the clinical skills rooms. And so what it is that, I'll show you on my phone. So you have something like this here. This is a bed, and the desk, and the patient will be on the bed or on the desk. You take a history, you do an exam, and there'll be an examiner sitting in the corner on an iPad telling you, not telling you anything, and giving you a score. I'll put this back here. Following me, cool. So that's your OSCE. The one at the end of the year, I don't know if it's formative or not. It really shouldn't matter to you whether you have to pass it or not. You should want to pass it, because obviously if you're not, that means that you're not at the standard that the clinician would believe that a year one student should be at for their clinical skills. And you've had a year to practice this. It doesn't matter whether you're the shyest person in the world, okay? It doesn't reflect that. It reflects the amount of work you've done and how professional you are with your work, okay? And that's another point I should have added, to professionalism. And that's being diligent with your studies, diligent with your work, and staying on top of everything, okay? That doesn't mean you can't have times where you need to, take a break, family things happen, right? But if you're professional in that time, in the lead up to an event happening where you need to have some time off or something, you should be mostly on top of it, right? These things don't just happen overnight. You don't suddenly fall 4 or 5 weeks behind like that. You fall 4 or 5 weeks behind by not being professional and diligent in that lead up, okay? So that's your OSCE. You have one of them at the end of the year. Your CATs, you have 4 of them. Your must pass extras, so you've got your Senior Citizen Partnership Program, reflections, okay? That is, you get partnered up with a elderly person or couple at a nursing home. You go visit them, you have a chat to them, you get some questions to ask them, and then you write a reflection using the Gibbs reflective cycle on how you felt when you were there. If you want my advice for this, it's just easier to just sit and write a stream of consciousness than it is to even use AI for these. I thought I was being smart at one point and sat down and thought I'd get AI to ask me questions like it was a journalist about each point and how I felt, and then write using my words. And I got picked up for AI, and it took me 4 hours to write this, what I thought was a wonderful reflection. And then afterwards I just wrote it in an hour and a half. Stream of consciousness. It wasn't as pretty, didn't read as nice, but they both got passed. It got passed, and I didn't get in trouble for AI use on that one. So just write it as you do normally. It makes it a lot easier, okay, and you won't get picked up, because AI is a professionalism thing. So I'm saying that now so you don't make the same mistake I did. So you have probably 2 to 3 of these. You either get graded a 0 or a 1. 0 fail, 1 pass, okay? You'll have a professionalism. and that is a pass or fail. So you have a pass or fail in the first semester and in the second, and that is from how professional you are the whole year, okay? Now they might get on top of you and tell you, pick your act up early, but they might not. And then you get to the end of the semester, it doesn't matter if you pass your CATs, doesn't matter if you pass your OSCEs, doesn't matter what you did. If you're not professional and they can't send you in the world with Curtin's name on you as you're teaching university, they're gonna fail you, okay? It's a big thing. So you can pass everything you want in the textbooks, but if you don't be professional, you'll fail. So that's another one. And then I think you might have some SJTs, so situational judgment tests. These are, I think they're formative, like they don't properly count, they'll tell you otherwise if they do. And it's a bit like that section of the UCAT where they go, George is a doctor and he's really tired and he took his notes home with him and forgot to give them to the previous doctor. What should he do? Should he call them and read them out? Should he just go to bed and not do anything? Should he drive back to the hospital really tired and give them to the other doctor and then sleep there? That sort of thing. So that's your assessments. Overall, there isn't a lot of assessments. It's a lot more, I find it a lot more enjoyable than other courses, especially how the first year used to be, where you'd have a test or an assessment every other week or every week for your various units. So be grateful and enjoy the fact that you won't have as many as the other students do, but that also comes with a lot of responsibility that you must stay on top of your studies before the exams, because that's the benefit of getting tested a lot, is that you're forced to stay on top of it, right? Because the best form of study is testing yourself. And so these courses, they're forcing you to stay on top of it, and so hopefully you'll pass at the end. With this, you're not, okay? So that's what I'd say there. Otherwise, let me think if there's anything else I wish I knew in first year. Mostly just the study methods that I have in my other videos. Watch my year 1 guide and my year 2 guide. And I'm coming out with the year 3 guide soon, but you don't need to watch that because it's very much similar to the second year one. So that's there for Anki, as well as how I use Boards and Beyond and other resources. Now the lecturers, they'll tell you that Boards and Beyond is no good because it's an American source. They'll tell you that some of the other sources are no good and you should just use your textbooks. I personally think you should be free to choose whatever you want, okay? When you're out and about in the real world, it's all about finding information in the way that best suits you and still relevant to your Australian guidelines, okay? So whatever works for you in the end, I just share what works for me. And then obviously, I also like to say that this doesn't, reflect anything upon Curtin University. It's all my own personal opinion. And while I may have chatted to staff about the course structure, that's about it, okay? And my last point is, stay curious, okay? Writing doesn't look amazing, but that's the point. Stay curious, okay? If you hear something and you go, I wonder what that is, or you read about it in a case, and even if it's not an LO, you want to just go where your curiosity takes you, okay? It makes it so much more fun, so much more enjoyable to be studying. You got to cultivate a mindset of curiosity and enjoyment for your studies, because it is a long degree, all right? There's no if buts about it, okay? You're going to be studying for the rest of your life. If you can't figure out a way to enjoy it now, then perhaps, consider a career change, because this level of study that we're doing now continues forever, okay? Even when you become a consultant after 15 years, you still have to study to stay on top of it, okay? And the patients really deserve that. That's the reason why they spend a lot of money on healthcare. That's the reason why this field's so competitive to get into. That's the reason why we're held to a high standard, is because we hold ourselves to a high standard to give the best possible care for the patients. And so by staying curious, staying on top of it, It means that you can study more and not burn out as quickly. When it comes to stuff like burnout, please, med school is not like high school. It's not like ATAR. It's not your entire life. As much as I've spoken about it like it is here, I do lots of things outside of uni, okay? The workload for your uni is a lot less than ATAR, especially if you did like 5 or 6 ATARs, okay? And you spend your mornings, your day, and your evenings studying, and you give up your sports and things like that. That's not what the med school wants you to do, okay? Just because you're in med school doesn't mean your life has to change. Like, doesn't mean that you have to put life on hold, okay? You can still go out, find your partner, you can still go out, you can do your sports, and I'd highly recommend you do. When it comes to sporting, don't do something solo, join a club, okay? I love triathlon, so I joined a triathlon squad, and that was awesome because it really gives you that structure of your days, and that you know that, every morning at 5:30 I'm going swimming or running or running, okay? Then you know that in your afternoons, every afternoon at 5:30 I'm gonna go hang out with my mates there, I'm gonna go do a session, and it forces you to put your time into blocks and study effectively, okay? There's a bit of a saying, it's like the work you have expands to fill up the available time. So if you don't give yourself too much available time for study of medicine, that's not a bad thing. It forces you to be more efficient, and it forces you to spend your time effectively, and not spend too much time on your studies. You shouldn't be studying for 6 hours a night, okay? They'll even tell you that it's a full-time degree, so that means that you should be combined uni and study 38 hours a week. I think maybe 32 hours a week, okay, it depends on, if you do something like Anki and you keep up with your first year content, and you have it in your deep memory, you actually study less as the degree goes on in terms of reviewing content because you've got it in your head. But yeah, you don't have to spend 50 hours a week on your medical degree, okay? It's really not what it's about, and they don't want that to be about it. Because if you think about it, if you start now with that high pressure and you keep yourself going for 40 hours a week, you're just going to be almost burnt out by the time you even graduate, let alone, and you're probably burnt out by the end of the year. But you're going to be burnt out by the time you graduate. You're going to have poor habits in place. You're going to be leaving things to the last minute. You're going to be spending way too much time, studying, and you're not forced to become efficient and ruthless with your time devoted to medicine. How are you going to then have a family? How are you then going to keep your health good? How are you then going to exercise as well as have time for social things? You're not, because you don't have those habits in place, and that's where it starts now. So I highly recommend you join some social club for sporting, okay, to keep your health. You need to keep your health right, okay? The more you learn about health, the more you realize that it's almost wealth, right? And so please join some sort of sporting club, be fit, try and be healthy, okay? Sleep, okay? Keep your sleep schedule set throughout the week. Once you start to learn more about sleep, you understand that in that last hour and a half of sleep in the morning, that's when your sleep spindles are taking information, and you're actually, conjoining information. Say you learned about old mate George's toe, 2 weeks ago, but then you learn about Margaret's other skin infection. Initially, you probably won't link them, but in that last hour and a half, your sleep spindles come along and they link that information along in that REM sleep. Now, why this is important is because it helps with your memory. It's obviously shown in studies that people that sleep less in that last period, they have really poor memory. And so what's the point of you studying an extra 5 hours if you're not going to retain that information because you're not sleeping, because you're studying that extra 5 hours, okay? So don't be sleeping 6 hours a night. Make sure you get your 8.5, 9 hours. I'm guilty of not getting that all the time. I think I averaged about 7.5 hours last year. But I'm really pushing this year to try and keep that closer to 8. And yeah, so that last hour and a half of your sleep, that helps with your memory a lot. So that's another big point I'll give you. In terms of your diet, try and keep it healthy, right? We learn about it. do your own research on it, figure out something that works for you, keep it, keep your weight, keep your diet under control, then you'll be fine, okay? There's no point in you going to med school to try and help people and then you get diabetes yourself, okay? It's not worth it. What else? Keep a social network outside of med school. You need people to talk to that don't give a shit about what you do. Sorry, excuse my language. They don't care about what you do at uni. It really helps you decompress because you can't talk to them about it in that sense. It's obviously good to have people to talk to about stuff you see and talk about at uni, but you also need the other side of it. Okay. I like to think about keeping this balance as a three-legged stool. So you've got your stool there, you've got one leg here, oh, ugly looking leg. You've got your leg there, another leg there, another leg there. Just bear with me, okay? If one of these legs is uni, one of these legs is family, or social, your wife, your boyfriend, girlfriend, whatever. And then one of these legs is extra stuff that you do outside of uni, something else that's a big passion for you. So you can swap in whatever you want for this third leg, but let's say for me that it's triathlon. Okay. You won't just see this. What happens if I cut off one of the legs, right? Obviously, the stool's going to fall over. Now, you might be able to get away with just keeping it there on two legs for a little bit, but then everything's going to come tumbling down. So it's important that you keep your stool in balance from day one, okay? And then that way you have those supports in place so that when things happen, events happen in your life, family member gets cancer, something like that, you are there and you can be supported and ready to go, okay? And by being diligent, being professional, your uni will handle itself throughout your career. So that's my final point is have a life outside of uni. It's really important. Just because you're now in med school doesn't mean it has to be like year 12 and you just get rid of everything to the sacrifice of the ATAR score. Okay, you get a little bit more time, so you need to make time for other things as well to live a balanced life. And work, when it comes to work, I worked 5 jobs in first year to support myself through college. Luckily enough, I was able to get some scholarships and things like that from second year onwards to really lower that to now 1 job, plus some tutoring on the side. I'm going to say, if you're going to work a job, please look at scholarships first. And then if you can find a job in healthcare, that would be really good as well. I did a lot of bar work and tutoring, pick bang for buck jobs. Tutoring is great because it's 60, 70 bucks an hour. As a med student, you shouldn't be charging anyone 50 bucks an hour. You are worth more than that, so charge them 70, 80, 90 bucks an hour. Okay, that's at a minimum. Don't charge 50, you're worth more than that, and then use that to make yourself some money on the side. If you can stay at home, if your home life's good, it's probably best, especially in the current rental market. But working with uni is really difficult. It's definitely part of the reason why I fell so behind in first year, but I didn't have the sort of study methods where it's only an hour or so a day of extra work. Now I think I could do it, but I'm fortunate enough to be supported by some great scholarships and some two jobs. So yeah, really think about your work and don't work to the expense of your degree. Okay, it's not worth it. And then really see what helps out there, see if there's family supports that can help you out. It's working and doing meds probably one of the quickest ways to get burnt out, especially if you need to work bar work and then you're up till 1 a.m. some nights, you're up to midnight the other night, and you got to come in early the next day for uni. You really burn yourself out really quickly. So just be smart with your work, and see if you can get a job, in a clinic as a receptionist, things like that. And you don't have to have family members involved in medicine. You have a whole cohort of people who are involved in medicine. I guarantee that probably 30-40% of people in your cohort have parents that are doctors, that might have practices that you can get a job at, working 1 or 2 days a week. And so that's my recommendation there. If you're Indigenous, the health cadet pathway is something that you should do. Don't do any other work, do your Aboriginal health cadet pathway, and you'll be given more information on that. If you want to contact me with any questions, my student number is 21504282. So you can just send me an email. Obviously don't spam me. And if you want to set up a consult for this sort of thing, how to study, your study methods, I have it on my website, patricklee.com.au. Obviously, I'll answer your emails for free. Obviously, I put this out for free. But, if we're going to be sitting down for an hour and a half doing a consult, then it costs you money, okay? My time's worth money, and shows my expertise, I guess, on this sort of thing. So I wish you guys all the best. Please enjoy the year. Don't forget to have fun and enjoy the, ease of first year, because it does ramp up quite significant after that. And so if you're going to do your traveling and things like that, do it in a break between first and second year, and just have a good time, make good friends, because you'll keep them forever, and go to all the social events that the med school and the various clubs put on. It's well worth it. And I definitely regret not going to some of them because of work commitments. Awesome guys. Have a great year.